Gentlemen, let's be real. Have you ever caught yourself wondering, how do those guys in adult films look so massive? Is there a secret? Why does my urine sometimes spray in two directions instead of straight? Or maybe you've asked yourself, why do I lose my erection the moment I start overthinking during sex? If you've asked any of these questions, you're not alone. In fact, these are three of the most common concerns men whisper about, but rarely feel comfortable bringing up with a doctor. Well, today we're breaking the silence. I am Dr. Jocelyn, a board-certified urologist with 5 years of experience helping men reclaim their confidence, vitality, and peace of mind. And in this video, I'm going to walk you through why performance anxiety can sabotage erections and how to take back control. The truth behind porn star size and the medical tricks some performers actually use. Why urine sometimes sprays or splits, and what it could mean for your prostate and overall health. And make sure you watch until the end, because I'll also share a step-by-step action plan, including daily habits, simple fixes, and science-backed options that can make a huge difference in your confidence and performance. Before we dive in, do me a quick favor. Hit that like button. It helps this channel reach more men who need real answers without shame. Comment below and let me know where you're watching from. I love seeing men from all over the world come together in this community. And of course, subscribe if you want more straight-talking, science-backed health advice. All right, let's get started. Let's tackle the first elephant in the room: erection problems caused by overthinking. Most men believe if you lose an erection, something is permanently wrong with your body. That belief haunts them. It keeps them up at night. It makes them avoid intimacy altogether. But I need you to understand something fundamental right now. That belief is simply not true. In fact, a large percentage of young men who struggle with erections aren't dealing with a physical problem at all. The machinery works perfectly fine. The plumbing is intact. The hormones are balanced. The issue lives somewhere far more complex and far more treatable. It lives in the mind. It's called psychogenic erectile dysfunction. And here's how it happens, step by step, in a way that might sound painfully familiar to many of you watching right now. The first time your erection falters, it surprises you. Maybe you had too much to drink. Maybe you were exhausted from work. Maybe the moment just felt off. Whatever the reason, it happens, and you brush it off. No big deal. The second time, something shifts. You remember the first time. You anticipate it happening again. That tiny seed of doubt plants itself in your mind, and suddenly you're not fully present in the moment anymore. Part of you is watching, waiting, worrying. By the third time, you're so nervous about staying hard that your body shifts into fight or flight mode. Your heart races, your palms sweat, your breathing becomes shallow, and your erection, it disappears completely. Think about what's happening biologically in that moment. When you're in survival mode, your body prioritizes blood flow to your muscles and brain, not your genitals. Your nervous system is essentially telling your penis, this isn't a safe time for sex. We need to be ready to fight or run. And just like that, the erection fades. Not because something is broken, not because you're defective, but because your brain is overriding your body's natural response. It's protection, not malfunction. The truth is this: the cycle can be broken with the right approach. As a urologist, I see this constantly in my practice. Young men in their 20s come to me terrified. Middle-aged men in their 40s sit across from me with their heads down, ashamed to make eye contact. Even older men who've had decades of perfectly healthy sexual function suddenly find themselves unable to perform, and they're convinced their sex life is over. But here's what research shows, and I want you to really hear this. About 87% of erectile dysfunction cases in younger men are linked to either psychological causes or early warning signs of cardiovascular health issues. That statistic should give you hope, not fear. The penis has some of the smallest arteries in the body, so changes there often appear before problems show up in the heart. Think of your erections as an early warning system, like a check engine light for your cardiovascular health. That means two important things. First, if you're under 40 and having regular issues, it's worth checking with your doctor. Not because something is broken, but because your body may be sending you an early warning signal that deserves attention. Second, if your heart and hormones check out fine, chances are very high that it's performance anxiety. And that, gentlemen, is absolutely fixable. Now let's break down these concerns in much greater detail, because understanding the problem is the first step towards solving it. Getting stuck in your head during sex is perhaps the most frustrating experience a man can have in the bedroom. We've all been there at some point. You want to perform. You want to please your partner. You want to be present in this intimate moment. But the more you think about it, the less your body cooperates. It's like trying to fall asleep by thinking really hard about falling asleep. The effort itself becomes the obstacle. Here's the biology behind what's happening. Erections depend on the parasympathetic nervous system. That's the rest and digest mode. It's the state your body enters when you feel safe, relaxed, and at ease. Blood flows freely, muscles relax, everything works as it should. Anxiety, on the other hand, flips you into the sympathetic nervous system. That's the fight or flight mode. It's designed to help you survive genuine threats by redirecting resources to essential survival functions. Those two systems cannot dominate at the same time. They're mutually exclusive. If anxiety wins, arousal loses. Every single time. Emotionally, this can feel devastating in ways that are hard to describe to anyone who hasn't experienced it. You may start avoiding intimacy altogether, making excuses about being tired or stressed. You may feel like you've lost your masculinity, like something fundamental about who you are as a man has been taken away. Some men spiral into depression. Others become distant from their partners. Relationships suffer. Self-esteem crumbles. But practically, here's what actually works to break this cycle. First, remove the pressure entirely. This might sound counterintuitive, but stop trying to have penetrative sex for a while. Focus instead on touch, kissing, massage, and intimacy without any expectation of intercourse. Take penetration completely off the table. When you remove the goal, you remove the pressure. When you remove the pressure, your parasympathetic nervous system can finally take over again. Second, gradually reintroduce sexual activity once confidence begins to rebuild. Don't rush this process. Let your body and mind reconnect naturally. Let positive experiences stack up and overwrite the negative memories. Third, consider a short-term prescription of low-dose tadalafil. This medication doesn't create desire. It doesn't make you want sex. What it does is help maintain an erection while you retrain your mind and body to work together again. Think of it as training wheels while you rebuild your confidence. Most men don't need it forever. They just need it long enough to break the anxiety cycle. And finally, remember this fundamental truth. Sex is about connection, not performance. The moment you shift your focus from performing to connecting with your partner, everything changes. You stop being a spectator in your own experience and start being a participant again. Now let's address the second major concern, comparing yourself to porn stars. Let's be brutally honest here. Most men at some point have compared themselves to what they see on screen. They've watched adult films and felt inadequate. They've measured themselves and felt disappointed. They've wondered if their partner secretly wishes they were bigger. But here's the reality that nobody in the adult entertainment industry wants you to understand. Adult films are not biology. They're business. Every single thing you see on that screen is engineered to make you feel inadequate. So you'll buy products, click on advertisements, and keep watching. Let me give you the actual facts. The average erect penis globally is 5.4 inches. 99% of all men fall between 4.3 and 7.2 inches. If you're anywhere in that range, you're completely normal. You're exactly as nature intended you to be. So why do performers look so massive? Let me pull back the curtain on this illusion. First, there's selection bias. Only men with significantly above average size are cast in these films. They're statistical outliers, not representatives of normal male anatomy. You're seeing the top fraction of a percent presented as though it's standard. Second, there are camera tricks. Angles, lighting, lens choices, and editing all work together to exaggerate appearance. A wide-angle lens close to the body can make anything look larger. Strategic positioning of the performers' bodies enhances the illusion. What you see on screen is not what you'd see in person. Third, many performers use medical aids. Vacuum pumps before shooting create temporary engorgement. Traction devices used over time can produce modest increases. Some performers even use temporary dermal fillers to add girth for specific shoots. Fourth, medications like sildenafil or tadalafil are commonly used before shoots to guarantee stamina and maintain erections through hours of filming. multiple takes, and unnatural conditions that would cause any normal man to lose his erection. And in rare cases, some performers have penile implants. These aren't for size, but for function. They allow the performer to essentially switch on an erection at will, regardless of arousal, fatigue, or any other factor. Biologically, here's what you need to understand. Your size has very little to do with your ability to satisfy a partner. Research consistently shows this. What matters most is blood flow, which affects firmness and stamina. What matters is confidence, which affects your presence and attentiveness. What matters is your willingness to listen to your partner and respond to their needs. Emotionally, constantly comparing yourself to these manufactured images chips away at self-esteem. It creates anxiety that feeds into the performance issues we already discussed. It becomes a self-fulfilling prophecy of inadequacy. Practically speaking, comparing yourself to porn performers is like comparing your Sunday morning jog around the neighborhood to Olympic sprinters. They're operating on a completely different playing field with completely different resources, preparation, and artificial enhancements. The comparison isn't just unfair, it's meaningless. Now let's talk about the third concern that men rarely discuss, the split urine stream. Ever stood at the toilet only to have your stream split into two directions and hit the wall, the floor, and maybe even your socks? It's embarrassing. It's frustrating. It makes you dread using public restrooms. But it's also worth understanding because sometimes it's nothing, and sometimes it's your body trying to tell you something important. Here's the biology. The urethra is like a garden hose. Normally, urine flows through in a single predictable stream. But if something partially blocks or disrupts the opening, the stream can split, spray, or become unpredictable. The most common and least concerning cause is dried semen or mucus at the tip of the penis. This can temporarily obstruct the opening and cause the stream to split. After ejaculation, residual fluid can linger in the urethra, and this causes a split stream for the next 1 or 2 urinations. Once the obstruction clears, the stream returns to normal. This is nothing to worry about. More concerning causes include benign prostatic hyperplasia, commonly called BPH. This is an enlarged prostate, and it's incredibly common as men age. The prostate surrounds the urethra, and when it enlarges, it can squeeze the urethra and affect urinary flow. Another potential cause is urethral stricture, where scarring from infection, injury, or medical procedures narrows the passage. This creates persistent flow problems that won't resolve on their own. Emotionally, many men don't talk about urinary changes because they assume it's just a normal part of aging. They accept deteriorating function as inevitable. But practically, if you notice a weak flow, hesitancy when starting to urinate, dribbling after you think you're finished, or frequent nighttime urination that disrupts your sleep, those are signs worth investigating. Here's a simple fix that many men overlook. Try sitting to urinate, especially first thing in the morning. In many European countries, this is completely normal and common. It relaxes the pelvic floor muscles, allows for more complete bladder emptying, and eliminates the aiming problem entirely. There's no shame in sitting. There's only comfort and practicality. So how do we turn all of this information into meaningful action that actually improves your life? For psychogenic erectile dysfunction, start by ruling out medical causes with a basic checkup. Get your heart health assessed. Check your hormone levels. Make sure the machinery is working before you focus on the mind. Then, reduce anxiety by shifting your focus from penetration to intimacy. Rebuild positive associations with sexual experiences. Give yourself permission to not perform for a while. Consider therapy or counseling with a professional who specializes in sexual health. They can help you identify the root causes of your anxiety and develop strategies to break the mental loop. And consider low-dose tadalafil as a short-term safety net. It's not a crutch. It's a tool to help you rebuild confidence while you do the deeper work. For size concerns, the solution is straightforward but requires a mindset shift. Stop comparing yourself to unrealistic standards. Recognize that what you see in adult films is manufactured fantasy, not reality. Focus instead on fitness, circulation, and stamina. What's good for your arteries is good for your erections. Regular cardiovascular exercise, a healthy diet, maintaining a healthy weight, and avoiding smoking all improve blood flow throughout your body, including to your genitals. If you're interested, traction devices used consistently over time can produce modest improvements. but understand that surgery carries significant risks and is not recommended for most men. The potential complications simply aren't worth it for cosmetic enhancement. For split stream or prostate symptoms, stay hydrated and make sure you're emptying your bladder fully. Don't rush. Give yourself time. Track your urinary symptoms over time. Note changes in stream strength, frequency of urination, urgency, or any pain or discomfort. This information is valuable when you see a doctor. See a urologist if symptoms persist or worsen. It could be a sign of BPH, which has very effective treatments available. Catching it early makes management much easier. And if you want a science-backed way to support prostate health proactively, consider a daily supplement with ingredients like saw palmetto, pygeum, green tea extract, and nettle root. These have been shown in studies to reduce inflammation and improve urinary flow. And now, let me pause here and tell you something that I need you to truly hear and believe. If you've struggled with erections, if you've worried about your size, if you felt embarrassed by urinary changes, you are not broken. You are not less of a man. You are not defective or damaged or past your prime. Every single one of these issues is incredibly common. They affect millions of men worldwide across all ages, backgrounds, and walks of life. These aren't signs of weakness. They're signs that your body is asking for care, attention, and understanding. Your body is trying to communicate with you. It's asking you to slow down. It's asking you to pay attention. It's asking you to treat yourself with the same care and compassion you'd show to someone you love. Gentlemen, age is not the end of vitality. I've seen men in their 70s and 80s with active, satisfying sex lives. I've seen men who thought they'd never be intimate again rediscover connection and pleasure. The human body is remarkable in its ability to adapt and heal when given the right support. Small, consistent changes make enormous differences over time. Checking your health regularly, improving your circulation through exercise, breaking the cycle of anxiety through patience and practice, supporting your prostate with proper nutrition and care. These aren't dramatic interventions. They're simple choices that accumulate into transformed outcomes. Your body is adaptable. It wants to function well. It responds to care. Your mind is resilient. The patterns that feel permanent can be changed. The anxiety that feels overwhelming can be managed. And your masculinity is not measured by inches. It's not measured by streams. It's not measured by performance statistics or comparison to manufactured images. Your masculinity is measured by your willingness to care for yourself honestly. It's measured by your courage to seek help when you need it. It's measured by your ability to connect with others authentically, vulnerably, and without pretense. The men I admire most in my practice aren't the ones with perfect bodies or flawless function. They're the ones who show up. They're the ones who ask questions. They're the ones who refuse to let shame keep them from living fully. That's real strength. That's real masculinity. And that's available to every single one of you watching right now. So here's your challenge. Leave a comment below. Tell me what's one healthy habit you're starting this week to support your body, your mind, and your overall well-being. Maybe it's drinking more water. Maybe it's taking a daily walk. Maybe it's finally scheduling that doctor's appointment you've been putting off. Maybe it's having an honest conversation with your partner about what you're experiencing. Whatever it is, name it. Commit to it. And know that you're part of a community of men who are choosing to take their health seriously, without shame, without embarrassment, and without apology. You deserve to feel confident in your body. You deserve to experience pleasure and connection. You deserve answers to the questions you've been afraid to ask. And I'll be here, in every video, providing those answers with honesty, compassion, and science-backed information you can trust. Take care of yourselves, gentlemen. I'll see you in the next one.